What complications make Saline implants need revision? Imagine your breast implants as a long-term investment in your confidence and appearance. Over time, however, some issues can arise that might requiring a revision surgery. Saline implants are generally safe, but like any medical device, they can develop problems. One of the most common reasons for revision is implant rupture. Saline implants have a silicone shell filled with sterile salt water. If the shell tears or breaks, the saline leaks out, causing the breast to deflate or lose its shape. This rupture can happen due to trauma, aging of the implant, or surgical factors. The deflation is usually noticeable because the breast appears smaller or asymmetrical, prompting the need for removal or replacement. The rupture rate for Saline implants is estimated to be around 2.5% within 2 years after surgery, but it can increase over time. Another major reason for revision is capsular contracture. When you get breast implants, your body naturally forms a scar tissue capsule around them. Sometimes this capsule tightens and hardens, squeezing the implant. This can cause the breast to feel firm or painful, and it may look distorted or unnatural. Many women seek revision to correct capsular contracture and restore a softer, more natural feel. Infection is also a concern. Although rare, infections can develop shortly after surgery or even years later. Signs include redness, swelling, warmth, pain, or pus. If an infection persists or is severe, the implant may need to be removed until the infection clears up, and then replaced later. Fluid buildup around the implant is another issue. Hematomas are collections of blood, while seromas are clear fluid accumulations. Both can cause swelling and discomfort, sometimes delaying healing. Large or persistent fluid collections often requiring surgical intervention to drain and possibly replace the implant. Implant malposition is also common. Sometimes the implant shifts from its original position, leading to asymmetry, rippling, or visible deformities like bottoming out or double bubble deformity. These issues can result from surgical technique, implant size, or changes in the breast tissue over time. Sensory changes, such as nipple numbness or altered sensation, can occur but are less frequent. If these changes bother the patient, revision surgery might be considered. Rarely, other complications like capsular lymphoma, a very rare cancer linked to implants, or shell degradation may necessitate removal or replacement. Factors that increase the risk of rupture or complications include improper surgical techniques, such as squeezing the breast to break scar tissue, which is not recommended. Contact with certain antiseptics during surgery, like betadine, can also weaken the implant shell. Overall, the most common reasons for Saline implant revision are rupture or deflation and capsular contracture. However, infection, fluid buildup, malposition, and aesthetic concerns also play significant roles. If you're considering revision, it's essential to consult a qualified plastic surgeon who can evaluate your specific situation and recommend the best course of action. Remember, each person's experience is unique, and personalized medical advice is always the safest route.